Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jarvis. So let us see the part 2 of Alternation of Remedies by Carol Dunham. Now let us have a clear understanding of what is exactly meant by alternation of remedies. Dr. J.R. Coxe does not give us a real distinction between alternation and succession of remedies. So Dr. J.R. Coxe, in the previous videos, you will have seen that he doesn't give us exact distinguishing point between alternation and succession. Dr. Quin of London calls the method of prescribing successive remedies in cases where the symptoms have changed and may require alternation of remedies. So Dr. Quin of London, he says that in alternation, there's a successive prescription of remedies in which the symptoms have changed, and it may require some alternation of remedies. Dr. Drysdale defines alteration as the giving of a second while the sphere of action of the first is still unexhausted. So Dr. Drysdale defines alternation as you give a second prescription or give a second remedy, and the sphere of the action of first is also going on, or it remains unexhausted. He does so only after re-examining the symptoms of the case and comparing it to the materia medica. So when we give the second remedy, we have to re-examine the symptoms and compare it to the materia medica. So now the question arises that how are we to know when the sphere of the medicine is exhausted? So that's a very logical question, that how will you come to know when the first action of the medicine is completely exhausted? Thus, Dr. Drysdale's definition seems to be vague and impractical. So whatever Dr. Drysdale has said in his definition is quite vague and is not of practical use, because we cannot find out that when the action of the first is exhausted. It becomes very difficult. Dr. Busy, in his paper for treating chronic cases, advocates alternation of remedies. He advocates Mercurius iodide in first decimal trituration for 7 nights, then sulphur, Collinsonia, Podophyllum, Ignatia, China, Aurum, Puslatilla and Phytolacca, each for 7 nights in succession in this order. So you can see out here, Dr. Busy has advocated a long list of different drugs to be given in succession for 7 nights each, starting with mercury and ending with Phytolacca. Thus, we object to this as it rests on hypothesis and not warranted by the possibilities of the science. So we have to object to this method of treatment by Dr. Busy. Why? Because it just rests on an hypothesis, which has to be proved whether it is correct or whether it is wrong. And furthermore, it is not warranted by the possibilities of science. So there's no warranty given that by using this method could be scientific and it would cure the patient. We have only to rely on the principles which govern the selection and the administration of the homeopathic remedy. So in short, the base is that we do not have to alternate remedies, but we have to rely on the principles which govern the selection and administration of the homeopathic remedies. What is that? That is nothing but the great law of similia similibus curant. It teaches us to select remedy on the characteristic pathogenic symptoms of the patient. So what does similia similibus curanta teach us? It teaches us that a single simple remedy is taken into account provided the totality is characteristic in nature. So the characteristic pathogenetic symptoms of pathogenetic meaning the disease symptoms of the patient have to be taken, but which are characteristic in nature. The common symptoms have to be excluded. The significance of the word symptom is to include everything abnormal about the patient. So basically, as you all know, symptom is the only way in which the deviated vital force, its manifestations can be seen. So it is a very significant word because everything what is abnormal about the patient will be exhibited through the form of symptoms alone. The symptoms collected have to be compared to the materia medica each time a prescription is made. So again, they're reminding you that each time you form a totality in which the symptoms are characteristic, you have to compare it, you have to compare the symptoms to the materia medica and confirm it whether it is right or whether it is wrong. So you always have to confirm that it is right, then only the prescription will be a favorable one and the patient will improve. So no doubt you have taken the full case, you have formed the totality, and the case is quite simple, the remedy is quite evident, but still you have to confirm it with the materia medica so that only to be double sure that you're on the right path. The drug chosen has to produce more similar symptoms to that of the patient. So why do you have to read the materia medica? Because whatever drug you have chosen, it will produce the most similar symptoms according to the law of similar, similibus, similar, current. Thus, it is called the true homeopathic prescription. So this prescription is only called the true homeopathic prescription if on the totality of characteristic symptoms, you base a remedy, confirm it with the materia medica, and then give it to the patient. It does not matter how many remedies have been given in succession, as each remedy was in accordance to the law of similars. So it may so happen that in one case, one remedy may not suffice, n number of remedies you may give, but each time you're giving the n number of remedies, you have given it according to the totality. So it doesn't matter how many remedies have to be given in succession, because each remedy was given in accordance to the law of similars. You can call it alternation or by whatever name you want. So the author says that if you do this practice of taking the full totality and giving the remedy, then you are following the true path of the true homeopathic prescription, which follows the law similia, similibus, currenta. And he says that you can call it by whatever name you want, call it alteration or whatever name you want, but you have to proceed on the correct path of the totality of the symptoms. Also, Dr. Hahnemann writing seems to have sanctioned alternation, but with specific directions. So in Hahnemann's writing also, at times he has used the word alternations, but he has made it very clear with some specific directions. He has mentioned that in a certain group of remedies is likely to be indicated in certain disease. He has sometimes used the word alternate. So out here he says that in certain group of remedies, it is likely to be indicated for a certain disease. For certain disease, certain group of remedies may be indicated, and sometimes he has used the word alternate. But actually, this doesn't mean alternate in its true sense that one remedy alternating with the other, but it means that you're taking the totality, you're giving one remedy, that remedy has completely exhausted its action, then you're retaking the case, you're finding out the new totality and giving the second remedy. So this word he has used as alternate. Yet he has always emphasized the fact that it should be in accordance with the symptom similarity as evident in the materia medica. So again, he has emphasized that whatever remedy you choose, after even examining the case afresh, it has to be in accordance with the symptom similarity as evident in the materia medica. So in other words, the baseline is that you have to take into consideration in each and every case the totality of the symptoms. Hahnemann always tells us to prescribe by comparing the symptom on similarity basis and confirming it with the materia medica. So time and again, Dr. Hahnemann will always tell you that you have to take a case properly. A well-taken case is half cured. He has said, after taking the case completely, forming the totality, you have to confirm the remedy with the materia medica. So for this, it requires the following. First point, in each case, the symptom of the patient have to be studied anew. So whatever case you are taking, you have to study each case as if it was a new case. Do not try and compare it with similar cases in the past which you have treated, because the symptom will differ from patient to patient. It has to be aggregate of symptoms presented by the patient and has to be analogous to the findings of the materia medica. So the aggregate of the symptoms that were taken, that is what, in short, the totality of the symptoms. That has to be taken, and it has to be analogous with the findings of the materia medica. So it has to have a matching symptoms in the materia medica. The drug selected has to produce in a healthy subject very similar symptoms to that of the patient. So naturally also that in the process of drug proving on a healthy subject, it has also produced very similar symptoms to that of the patient. The drug prescribed should be in the form or combination in whichever way they were proved. So whatever drug was prescribed, it has to be in a particular form or in a combined form. For example, if you say calcarea and silicia. So calcarea has its own group of drugs, silicia has its own group of drugs. But if a drug calcarea silicate is taken, it is proved both these drugs are being proved in a combination form, and the symptoms are different. So you have to see in which form it has been proved, either in a single simple form or in a combination form, in which Kent called this as a synthetic prescription. Okay, so if drugs were proved in alternation, we might perhaps prescribe in alternation also. So therefore, he tells us that if the drugs were proved in alternation and if the totality was taken, then we can be justified also in prescribing in alternation also. For example, if you put two drugs, for example, Rostox and Bryonia in alternation, in a proving, and you've got hardcore symptoms of that drug in alternation, in proving, then if the same symptoms are present in the patient, then you can give it. But the proving has to be done in a combined stage. That is, proving of Rostox and Bryonia both together. Thus, the people who use this method of treatment can be divided into two classes. First, the one who has by experience used alternation successfully. It cannot be discussed on scientific grounds. So there are some people who have used alternation of remedies by giving two or more remedies in alternation with each other. For example, Bryonia, Rostox, Sulphur, Nux vomica, and so on and so forth. So he says that you cannot discuss this on scientific grounds. There is no reference to the general principle of natural law. So why can't we discuss it on scientific grounds? Because there is no reference to the general principles or to the natural laws. Second is that, so this is the first class of people who use this method. And now the second class of people, here they accept the definition of requirements of a sound prescription based on natural laws. So out here, this class of people, they have to prescribe or they accept the definition that a sound prescription should be based on certain natural laws. They claim that the established principles are in accordance with scientific principles and thus know how and when to alternate. So they claim that whatever remedy they are finding out, it has been established on scientific principles according to the established laws of homeopathy, and they know when to alternate. As and when the symptom changes, the remedy will also change. So then, therefore, in a case, suppose you have symptom Rostox, you give Rostox. When the case has ceased to produce more amelioration, you again retake the case, and now you find the modalities of Bryonia. So then you can give Bryonia. So in this manner, you are doing it in a very scientific manner, when to alternate, provided the symptoms match. Dr. Drysdale says that the practice of alternation rests in maintaining the susceptibility. Dr. Drysdale also adds one more dimension, is that alternation, the principles of alteration is because you are maintaining the susceptibility. The main question of using alternation of remedies is to revive the exhausted susceptibility. It may be that in a case the susceptibility has been exhausted. So in order to revive the susceptibility, Dr. Drysdale says that you can use two medicines in order to evoke or in order to get life to the exhausted susceptibility. The exhaustion of susceptibility can be made out when the symptoms change. So Dr. Drysdale is of the opinion that the symptoms change because the susceptibility has been exhausted. It now indicates for a new prescription. Thus, Dr. Drysdale defends alternation by saying it meets with the compiled complications and helps to awake the susceptibility. So this is his method, saying that Dr. Drysdale says, or he defends that what he is doing is correct, alterations are correct, can be used because they help in reviving the exhausted susceptibility. And it also helps in combating the complications of the patient which they are subjected to. Now, some salient features of alternation of remedies. It can be argued by those people who regard the practice of medicine as art based upon scientific principles. It does not include those people who practice it out of individual experience. It must be excluded from the scientific principles so that there is no ground for further discussion on this topic. So basically, when you use alternations, you have to exclude the scientific principles so that the process of further discussion on this topic is not guaranteed or not done for. People who practice alternation, more the practice, don't understand properly of what is actually called by alternation. So basically, the word alternations of remedy has been misused, or the practitioners, they do not understand exactly what we mean by alternation. It is to be understood that on a sound homeopathic prescription, and this requirement is not met with them, it cannot be called alternation. So if you want to use alternation, it has to be done on a sound homeopathic prescription or on a sound homeopathic basis, following the principles of homeopathy and the law of similars. So this cannot be met when you do alternation. That means what? You just cannot find out two remedies, both these remedies, they fit the patient very well, so I give it to the patient. But use your scientific mind, find out the totality, give one remedy to the patient. When that remedy has acted well and it has acted completely, and furthermore, no more emulation is taking part on the patient is becoming status quo. That is what? Patient has improved 80% and 20% still remains. So what does Dr. Hahnemann tell us? That you again retake the case, find out the change totality, find out the change symptoms, and give a second best prescription. So the first prescription is remedy A, second prescription is remedy B. So the remedy A is different from remedy B, but both of them have been decided on the principles of homeopathy. It is not that blindly I give a remedy A and then alternating with remedy B. So this method of alternation has been misunderstood or not properly perceived by the physicians. Alternation is based on an established principle in homeopathy, which is demonstrated by drug proving and clinical experience. So the method of drug proving and clinical experience only will prove the same. Each drug has its own specific sphere of action on particular part, location, or organ of the body. So in drug proving, naturally, each and every remedy will have a specific sphere of action on a particular part, location, or organ of the body. Many examples and further discussion is done, which are given from in page number 194 to 204. So if you want to read further, many examples are given of different drugs having specific action on different part or location, and great explanation has been given regarding the same. So this is nothing but from page 194 to 204. It is nothing but a repetition which is kept up previously by Carol Dunham. So I haven't made any more PowerPoints on the same. You can just have a look at these pages for more deeper understanding. But the basic idea I have given you. So I hope I made this chapter simple for you to understand, and I hope you all do well in your examinations. Thank you very much.